This video was prompted by a coincidence, and when I say coincidence, I don't mean an accident. I mean coincidence in the classical sense of the word is fitting together perfectly. So when two things point to me to do a video, I usually do it. The first thing was a lady telling me this, and the second thing was a book that I'm editing called The Facebook, nothing to do with Facebook.com, but The Facebook, that is a consumer guide to facial plastic surgery. What I learned is an inadequacy in my preparation for a patient in the postoperative first week after a procedure. The word that I want to address is an unfavorable word, but one that needs to be addressed explicitly, which is depression. I don't know what percentage of my patients experience it, but at the same time, I do want to address it in a way that's explicit and overt. Because sometimes when you're going through the healing phase, you may not recognize yourself, you may question your decision of having had the procedure done, you may be strained in your relationship with your spouse, you may just not feel good, and a little bit of discomfort. Whatever confluence of feelings you may have, allow yourself to feel them, because they're real feelings. Feelings are not fake, they're real. And so as a surgeon, I want to be sensitive to that. And for me to be sensitive to it, I first have to understand it. And of course, I haven't gone through cosmetic surgery myself, so I don't understand all the ramifications and details. But that first week, if you actually feel depressed, it may be normal. It is normal. And it's something that's part of the healing process to some people, not everyone. So I just encourage you to let yourself enter a state where you understand that that's normal, and not to be self-judgmental, and let yourself have a break. Usually most people come out of it after the first week, but at the same time it could linger for another week. It's almost like, I guess, postpartum depression or something else, but I don't know that entity well enough to speak on it, but it is something that could occur for you the first week after procedure. So I just want you to hear my voice and understand that I am sensitive about it. I do recognize it now more fully after editing this journal and having a patient actually use that word to me. And I want you to understand that that could happen to you. If it does, come and speak with me. You'll have my cell phone after the procedure. I encourage you to allow me to walk you through it.
Perform